Okay, here we go. Again, thank you so much for joining me. This is our frequently asked question webinar. I'm Laura Santner. I'm a clinical social worker. I'm also a registered poetry therapist. And I've been working with BFRBs now for quite a long time. So I'm looking forward to answering your questions to the best of my ability. We're going to go over the pre-submitted questions. Some people emailed some questions beforehand. So we'll do that first. And then we'll go over to your questions. And you can just write into the question and answer box, and I will get to that after we do the pre-submitted questions. So it's going to be pretty casual. So just sit back and relax. Maybe you have like tea or hot chocolate or water. I wish I had my water right here and I don't. Maybe grab your favorite fidget and let's get right to it. Okay. So let's see. The first pre-submitted question is the cause of skin picking related to genetics. So so research does indicate that there may be an inherited predisposition. Even if there's a predisposition, though, towards having a BFRP, or in this case, skin picking, there also has to be other factors involved. So other factors can include hormones, your temperament, age of onset, other potential co-occurring disorders, environmental stressors. So BFRBs are caused from a variety of factors, and the variety of factors that all interact with each other. So that's what results in the behavior. So it is possible for someone to have a genetic factor, a predisposition, but all the other stressors never happen. And so therefore, their BFRB is never actually activated. So I hope that answers that question. Of course, if anyone has follow-up questions, as I'm going along, just write in the question and answer, and I'll get to that after we go over the pre-submitted questions. Next one. Let's see. What is the prevalence between men and women? Is it perceived that it is a woman issue? Okay. So actually, BFRBs are equal opportunity. So it can affect both men and women the same, equally. They are, however, highly underreported and also underdiagnosed. So oftentimes, because of that, it gives the illusion that women have it more often, but it's not necessarily true. It's also possible that men are less likely to report having a BFRB than women. So you might see them in treatment less frequently. So that doesn't mean that they have it less. So in summary, it's equal, equal between men and women. Is dermatillomania a new condition? When was it discovered? I have to admit, I had to look up some facts for this one because I wanted to be accurate and give you guys some dates. The short answer is it is not a new condition and it has been around for quite a long time. The detailed answer that I looked up was that, let's see, it was first mentioned in literature in 750 BC. And then it was first noted in documentation in 400 BC. In 1893, a French dermatologist was the first to do a scientific report on trichotillomania, not skin picking disorder, but on hair pulling disorder. And then it became worldwide actually in the 1920s. Articles started coming up. So there were about, my research showed me that there were 33 articles that started to explore the different causalities. And then the Trichotillomania Learning Center, that was founded in 1991. So that was the first organization that started to dedicate its work towards reaching out to people and to research and to finding the community of people and gatherings and conferences. And then out of that became the first medication study in 1997. And of course, other things have been happening since then. So as you see, it has been around for quite a long time. It is just surprisingly not very well known. I wish it was more well known. Hopefully in the future, we're kind of slowly coming along and we're getting there. Okay, this one was next question. Any tips on how to tell people you have derm or dermatillomania? So first off, you don't have to tell anyone, and you don't have to tell anyone if you don't want to. And if you do decide to talk about it with someone, make sure you're comfortable. Talk to someone who you trust, and make sure you feel ready. Um, if you're talking to someone, I mean, you decide how you want to tell them. So maybe you want it to be a phone call, maybe you want it to be an in-person conversation, but you pick the time and the place, and the how. What can be helpful when you're telling someone is, I mean, just first off, like tell them what it is, what the name is, kind of what it's all about. See if you can give some information, and tell them what the urge feels like. And then it's actually surprisingly common. About 1 in 20 people have this disorder. And if and encourage them to ask questions, engage, have a conversation about it. You can also bring in information, meanings like some articles or pamphlets, or direct them to a website such as skinpick.com, where they can look up additional resources. Most people are supportive when you tell them. And oftentimes when you tell them something personal about yourself, they'll tell you something personal about themselves. So it kind of feels like a bonding moment, and it kind of strengthens the friendship or relationship of some sort. It does happen that sometimes the person would react negatively. I feel like that's pretty rare, but it does happen. So if it does happen, don't feel discouraged, even if you probably will be. That's a sign that maybe that just wasn't the right person, either to talk to about it, or just not the right person to have in your life. You know, do you really want someone in your life that's going to react that negatively to something like that? Um, so that's just something to keep in mind. Let's see. Hope that answered that question. Let's see. Will skin picking cause permanent damage to my skin? So the short answer is both yes and no. So skin picking can leave scars, but they range from very minor, and they can go to be very serious. So it's really just individualized. So if they're very minor, I mean, they can go, scars can go away in, a week or two. If it's like moderate, let's say, can go away, can take maybe about like six to like 18 months to go away. If it's severe, it can cause tissue damage. It can lead to infections, can lead to more serious complications, including all the way over to needing potential skin grafting. So there is a large range. I would say the majority of pickers pick in the minor to moderate range. Although the more severe, of course, exists. And they are out there, and you are not alone if you are on the more severe scale. If you are on the more, I would say, severe scale for skin picking, make sure you're connected with a dermatologist so they can kind of help you with the healing process, and to prevent any kind of infections. Let's see. Why do I pick my skin? So urges typically arrive when someone is understimulated or overstimulated. So um, Overstimulated, for example, is like when someone is anxious or stressed or overwhelmed. If someone is understimulated, an example of that would be like you're bored. So it could be both. It could be either or both, right? So picking winds up acting as a way to kind of regain that balance when you're feeling overstimulated or understimulated. Um, Another way to look at it is external triggers versus internal triggers. So that's another possible cause of why you're picking your skin. So external triggers are like stressors, things that are going on around you that you really can't control. And internal triggers are like your thoughts and feelings and your reactions, the things that are going on inside of you. Um, Also, when thinking about why do you pick your skin, I think about the acronym SCAMP, which is sensory, cognitive, affect, motor, and place. Um, so all of those things can impact your urges. So the sensory aspect, um, meaning how things are looking, how things are feeling. The cognitive aspect, what are your thoughts? The affect is like how you're feeling. Motor is kind of like I like to think of it as your movements, your positioning. So if you're like this all the time, like that just might, you're in this position, so you might just have an urge automatically. And place, where you're located. So at a computer, a desk, the couch, the bed, bathroom, for example. Okay. So I hope that answers that. And there is, again, there is no one reason. It's kind of a lot of things at the same time, which is why it makes this disorder so complicated. Okay. And I do see questions are coming in, so I will get to that in a moment. How can I cover up my scars? Okay, so depending on where scars are, depends on how you're going to cover it up. So if it's on different parts of, I guess, the lower body, different kinds of clothes like long sleeves, short sleeves, pants, turtlenecks. So you can't really get in there. Stockings. You can also wear makeup to kind of cover things up. If you have any open wounds, though, I do not recommend wearing makeup because you want to keep everything clean and you don't want to risk any kinds of infections. You can also, depending on the location and your comfort level, use like little like pimple patches or mighty patches because that acts as a block and it helps to heal at the same time. Um, Okay, those are just some examples. How can I prevent infections? Okay, so I mean, first off, just keep your wounds and the area clean. Clean with water, cover with Band-Aid or any kind of gauze dressing. Um, and change it frequently, especially if it gets dirty or wet. Um, that's a really important part of preventing infections. And of course, using antibiotic like creams or treatments. Make sure you thoroughly wash your hands with soap and water like throughout the day. That's really important because if just in case you do wind up repicking that area or touching that area, you don't want to spread any additional bacteria. So try to keep your hands clean. That would be maybe my top tips. If you're cleaning it, if you are applying like any antibacteria lotions or creams, make sure your hands are clean. And if you're not using your hands, use like a Q-tip or something so you avoid touching the area. Some people, I am not familiar with this, but some people say that using tea tree oil helps to prevent infections. They say that boosts activity of like white blood cells and reduces inflammation. I'm not an expert on that. Maybe do a little bit more research, but some people say that can be helpful. And definitely make sure you're connected with a dermatologist. They're the ones to ask specific questions about infection, make sure they are looking at it and can review wound care and go over treatment options with you. So having a dermatologist. Okay. What can I do to block myself from picking? Okay, so there are many different strategies when working with BFRBs, and one strategy would be using barriers. So in this question, what can I do to block myself? So a barrier is what you use to block yourself. So some potential barriers could be long sleeves, again, turtlenecks, like I mentioned before, pants, stockings. Some people, especially these days now, are wearing masks. If you don't feel comfortable going out in public, depending on where you are, you can wear a mask that would block your face. Some people put rubber bands on their sleeves to prevent you from rolling it up. That could be a potential block, or just like a bracelet or a watch or something over your shirt. You just want to make it harder for yourself to roll things up. You can also have barriers, of course, on like your hands and your fingers. So things like gloves. I always like gloves, like thin cotton gloves, or they have these things, these billiard gloves, which I really like because they only cover, I think, 2 or 3 of your fingers. And they come in really nice soft fabrics, so I like that one. They also have thumb guards that just cover your thumbs. Then there's like rubber fingertips. And of course, like Band-Aids on your fingers, on your fingertips. At least these two to help. I personally really like Scotch tape. I like at the tips of the fingers, I like Scotch tape because they're kind of fun to flick and play with. It's clear, so it's really subtle, and it's cheaper. Other barriers you can consider, again, there are lots, I'm just kind of naming a couple. Things like Vaseline, or even just using lotions often just to keep things slippery and a little bit more slimy, so it's harder to it's when you get there, when you get to your area, you kind of slip and you're like, it's not worth it, it's not as exciting. Okay. All right, let me jump. Let me open this up here. Okay, those were the pre-submitted questions. I'm going to jump to the ones that you guys are submitting right now. Okay, so let me try to organize myself here. Okay, so best way to deter my 6-year-old from picking. Is it better to ignore the behavior or interrupt? This is a good question. For younger children, I would say it is helpful to interrupt, but interrupt by giving your 6-year-old like toys, fidgets, have them do something with you, change their activity. Don't interrupt by saying, stop doing that. Don't pick your skin. Interrupt by giving them something else to do. Redirect their attention. I suggest doing that in combination, depending on when they're doing it and where they're doing it, is using barriers, such as like if they're picking like at night when they're in bed, for example, like going to bed with gloves on. Or if they're at home and they're comfortable, like putting some Band-Aids or something on their fingers. You'll have to see kind of what your 6-year-old is comfortable with and how they respond. So I would say that's what I would say for that one. Yeah, yeah, okay. Um, all right. Um, Along the lines of genetics, I'm really worried that my son is going to pick up my skin picking. How can I discourage a toddler from picking if he starts because he sees me doing it? Yeah, I really like this question as well. So just because you have skin picking does not mean that your son here in this example is going to have skin picking. It's just one factor. So it's one potential risk factor. Um, it also depends on, like I said, what else is going on, like at the home. Keep a relaxing environment. Be a role model. That doesn't mean, when I say be a role model, I mean express how you're feeling. Um, Make sure you practice really good communication skills and make sure he knows that he can go to you if he needs to or if something is on his mind. Um, Even if your toddler, your son is seeing you picking your skin, that doesn't mean he's going to copy. Um, so don't be so hard on yourself. um, if you feel like he's starting to pick because he sees you picking, um, you can always say something. For example, oops, I'm sorry you saw that. I didn't mean to in that moment. Let's do something else together. Like, don't really make a big deal of it. That's what I would say. Um, yeah. So other, how can I discourage? I would say that's it. Yeah. I wouldn't worry about it until you actually see him starting to pick and it becoming a pattern. But just by looking at you and or seeing you every so often, that's not going to do it. Okay. Hmm. Are general strategies treatments shown to be effective for pickers with ADHD and autism? Um, yes. So yes and no. So the general strategies and the general treatment, it is the same. Um, you have to pay a little bit extra attention when someone has ADHD or has autism. Both are quite common. I would say ADHD is more common than having autism as co-occurring disorders. With ADHD, um, really emphasizing the importance of structure and routine is really important in that treatment plan. And someone with autism, you have to be extra mindful about how you're wording things and making sure the understanding is clear. So you're all on the same page, and you might have to go a little bit slower um, just to make sure everyone is kind of grasping it and having time to practice. Um, and same with ADHD as well, actually, going through it slowly at a pace that seems reasonable. Um, and you might want to keep things a little bit more interesting, especially if it's an in-person or a video treatment. Make it fun, like make fun charts. That's helpful for both of them. Make some games out of it. Make like games out of like expressing yourself and what are your thoughts, what are your feelings. Do a reward system. That's always great with kids. So that's what I would recommend for that. But in general, the treatment is the same. Okay. Okay. Oh yeah, these questions keep popping in. Thank you. Um, hmm. Okay. Adults who have a skin picking disorder, do they tend to have had a history of skin picking as children? I have a child with dermatillomania and I wonder if it is like we caught it early. Does it tend to be a lifelong process of being in recovery and continuing prevention? So skin picking disorder can kind of come up and be activated at any time. Just because an adult has it does not mean that they had it as a child. However, the most common age when it begins is around the teenage years, like 13, around puberty, when kind of all the hormones and body and everything is changing. Um, so it's not necessarily, so if you see it in a child, it's not necessarily that you caught it early. It just kind of pops up differently for different people, again, depending on that combination of factors. Um, Once someone is diagnosed with skin picking disorder, I mean, it is a chronic mental illness. So unfortunately, it is a lifelong process of being in recovery. But that doesn't mean it's always going to be active. So someone can kind of learn all the skills and strategies and feel good about it and are able to manage it for years and years and years and years, but they might be thinking about it. It just might not be active, and they might, again, be able to manage it, but it's kind of a part of it is always going to be somewhat in the back of your mind. Um, so I would say it doesn't like 100% ever go away. Um, but it can be very much managed and very much managed for a very, very long time. I hope that answers your question. Um, Using strategies, though, is part of the question about continuing prevention. Using strategies is a good idea to just always be aware of, because again, the urges can come and go, and you just never know what might kind of reactivate it if you have it managed well. Um, you can have ups and downs. Okay. Interesting. Any favorite products to aid in prevention, particularly wondering about bandage types? My child's area of skin picking are on her back, like below her shoulders, and has been difficult to find a best way to cover wound scabs, both for healing and for preventing more picking. I don't have any favorite product. It depends on, I guess, how big the area is. And something to be mindful of also is depending on what you're using. Some people have skin sensitivities. So you want to try different things. So if you're using a product or a bandage and you're noticing it's getting red or red around it, that might not be the right product for you. Um, because skin sensitivity is a real thing. And if the bandage you're using is causing more redness, guess what? That's going to cause more picking. So just something to keep in mind. I do like the product called the Mighty Patches. I believe they come in different sizes. So that is a product that I like and people have liked. I have also heard, just like I said, people have had reactions to the Mighty Patches. So I've heard both good things, more good things than bad things, but it does happen. Um, there's so on the back, like below the shoulders, back below the shoulders. So also besides bandages, yeah, again, like I was saying, to use some barriers, like making sure shirts kind of cover that area. Um, of course, it's not going to work all hours of the day, but at least for sometimes. So different kind of clothing, and even clothing that has some really nice texture that's really soft. So if your child goes to kind of that area, they might get a little bit distracted by the fabric. So that might feel really nice, like velvet, corduroy. My sweater that I'm wearing right now actually is very soft and fluffy, so it kind of feels nice. Um, Things with tassels on them or fringes could be a nice distraction if the hand starts going over there. Okay. Ah, can skin picking cause skin cancer? No. Nope. It can cause infections, but not cancer. No. So, phew. One less thing to worry about. Okay. Often people say the best solution is to hide mirrors. The problem is that I mostly skin pick on my shoulders and back chest area, so I don't need a mirror and don't know how to restrict myself. So hiding and covering mirrors, putting Post-it notes on mirrors, for example, are really good strategies. But if you are not picking in front of the mirror, then that strategy is not going to do anything for you. Hiding mirrors and covering mirror strategy is only helpful if you look in the mirror when you're picking. So if you're not looking in the mirror when you're picking, that's not going to do anything. So how to restrict yourself? There are a lot of so there are a lot of methods and a lot of strategies to work on skin picking. So if you're curious, I mean, I can't go over all the strategies. There are so many. Like I said, there are, for example, sensory strategies. I'm just referring back to that scam. So there's sensory strategies, there are cognitive strategies, thought strategies, affective strategies, strategies that affect your feelings, that motor strategy, which are methods of blocking yourself, and place and changing your location strategies. So think about that and try some of the other things if the mirror is just not for you and not working for you. There are many more. And oftentimes it's a combination of strategies. It's not just one thing. I've tried CBT and there are, I've tried CBT. Are there other tools to control the urge long term? If it is stress and anxiety related, can stress medication help? I'll say a couple of things for this question. So the treatment for skin picking or BFRBs is a combination of treatments. So CBT is just one aspect of treatment. Other aspects is ACT or acceptance and commitment therapy. There's some DBT in there, dialectical behavioral therapy, specifically mindfulness practice, and distress tolerance, emotion regulation. That's kind of within DBT. There's also habit reversal. Habit reversal training is part of the treatment. There is the comprehensive behavioral model, which kind of incorporates a bunch of these. So it's kind of like a CBT plus. So it includes all of these things. And other people add in additional treatments such as just like psychodynamic talking. That helps as well, of course. Just to name a few. When you're working on your strategies or your tools, you're actually not working to control the urge. You are working to manage the urge. I like to make that difference because when you have this idea of control in your head, it puts more pressure on yourself, and you're actually less likely to succeed. So that this idea of control is going to stress you out more. So instead, I like to think of the word managing. You're managing it. That takes a lot of that pressure off, and it allows more space for self-care and self-compassion. Stress and anxiety may or may not be related for you. Some people can have anxiety as a co-occurring disorder, and some people might not. If stress and anxiety are factors for you, yes, anxiety medication can help. That said, there is no medication just for skin picking, but if you have other things going on, medication can help relieve some of those other symptoms, which may in turn help with skin picking. Okay, so lots of different parts to that question. Hope that was helpful. Woo, we got lots of questions. Okay. How common is excoriation disorder in children? Is there any known best treatment for children that might differ from that for adults? Um, so it is quite common, like I said before, about 1 in 20 people wind up having excoriation disorder, also known as skin picking disorder. So the treatment is pretty much the same. Again, the things that would differ between children and adults is the language that you're using, making it more fun, more accessible. So like having really fun charts if you're charting, having a reward system is really great for children. Um, the main difference between working with children and adults is children might not be ready. Um, and if they're not ready and don't want to work on it, then there's only so much you can do. But really helping the child focusing on using like fun fidgets um, and rewarding them for using fidgets is a helpful strategy. Is there any medication or supplements that treat it effectively? So no, there is no medication, unfortunately, but they're starting to get closer. So right now, there is an FDA approved supplement called NAC or N-acetylcysteine. So right now, that is the most commonly used and one that's most recommended. That said, more research needs to be done, of course. And that's something that you would maybe need to follow up with your doctor just to double check and do more research. There are, by the way, there are articles on skinpick.com on NAC. So I recommend checking that out so you can get a little bit more familiar about what it is. Okay. Every time I go to a dermatologist, they try to put me on medication. I really don't like using mood-altering medications. Is this really my only option? So I'm a little confused by this question because why is a dermatologist prescribing a mood-altering medication? A dermatologist should only be prescribing medication that's going to heal the skin. Um, there is no medication that's going to stop you from picking your skin. So if you're somehow being prescribed a medication that's changing your mood, then that's not the right option for you. You never have to take something that you don't want to and that you're not comfortable with. There is no medication for skin picking for BFRBs. It's all of these other treatments that I just recommended. So try some of the other treatments, maybe hold off on the medication and see what happens. Okay. Oh, how do you know if your scalp is infected? Oh, good question. So usually a sign of infection is if it's kind of turning a color, so turning like yellow, for example, or getting like pussy. And if it starts to smell, you're not really going to be able to smell your scalp, but you can look. So if you start to see some discoloration and some pus, that's a sign that it's getting infected. Also, if it's not healing, and if it really hurts, those are some signs that it's infected. And you definitely want to go to a dermatologist and get some treatment. Hmm. Oh, I'm getting some thank yous here. You're welcome. Um, this question I'm actually not familiar with. which is why I'm kind of pausing. Do you have any shadow work prompts for picking? I'm a big believer in shadow work, but haven't been able to find any at all on this topic. Um, I'm sure I know what this is, but I'm just not familiar with the name. Shadow work. Maybe you can write again and just explain to me what shadow work is, and maybe it will spark my memory. And I will have more feedback for you. And if not, email it to support@skinpick.com, and I will look more into it and get back to you. Okay. So sorry I can't be of more help with that one for now. So I'm getting some repeat questions. Let me see. I'm gonna skip that one for now. I don't know. I'm getting a lot of, I'm seeing a lot of medication questions. So again, right now there is no medication specifically for skin picking or for BFRBs. The closest that's out there is called NAC, N-acetylcysteine. That's the most researched and the one that's most promising right now. There's a new one, and the name is, I'm blanking on the name at the moment. And they just started researching this new one. So even if I remember the name at the moment, it starts with an M. I wouldn't necessarily recommend that one yet because it's still brand new. So right now I would say just NAC. Uh, okay. Oh, do you have any suggestions for moving on emotionally from a relapse? It's hard. It's hard, and be mindful of what you're telling yourself. I actually don't like the word relapse, so maybe just even rephrasing that would be helpful to move forward emotionally. Instead, I like to use the word slips. Relapse gives that feeling that it's you have to start all over again. And I don't like that kind of assumption. So slips makes it feel more like, oh, I had a slip. I'm gonna get back on track. Um, when you have a slip, it doesn't mean that you've ruined everything. It doesn't mean you have to start from the beginning. Everything that you've been practicing and working on is still there. All your skills and strategies, they're still there. Slips happen, and it's part of the journey. So telling yourself that can be really helpful. And having a lot of self-compassion, being kind to yourself, maybe doing extra self-care. Having a spa day, wear something really nice that makes you feel good. For example, get outside, do some outside activities, get some fresh air, see nature. Doing things like that, engaging in something that you really like to do, a hobby, will help you to move forward and to get back on track. The more you kind of stay stuck on, oh, I can't believe I did this, the worse you're going to feel. So that would be some of my suggestions. Be mindful of what you're telling yourself. Oh, someone's asking about connecting with someone else in the chat. I have no idea how to do that. So unfortunately, that's not going to be possible. But if there are other parents, this is, I guess, a parent that wants to connect with another parent in the chat. If there are parents that want to connect, there are parent support groups. I don't think there are parent support groups right now with skinpick.com, but TLC or BFRB.org, they have some parent support groups. So I do recommend looking into that. There are also parent Facebook support groups, so that's something you can also check out. So do you have experience with habit reversal training, HRT, and is this the most effective treatment? So yes, I mentioned this in the beginning. I will repeat it if you missed it. So treatment is actually a combination of things. So one thing alone is not going to work. So habit reversal training, I would say, is not the most effective treatment. The most effective treatment is the combination of treatments. So a combination of habit reversal training, along with CBT, along with DBT, along with ACT, along with COMB, or the comprehensive behavioral model, along with some psychodynamic talking and seeing what's going on. So it's a combination of everything. So it is not just one. The most effective treatment is combining everything together. Okay. So this question again is, I have been picking my skin since I was a child. My mom did it too. There's a little bit of that genetic factor. We talked about, can skin picking ever be cured? So skin picking disorder is a chronic disorder, meaning there is no cure. But that does not mean you're going to be picking your skin forever. It can be managed with the treatments that I just mentioned. That combination, you can work to manage it. So it can very well be deactivated kind of in your body, in your system. Just because it's deactivated does not mean it's cured. Part of it is still there, but it doesn't have to bother you. It doesn't have to be active in your life. Hope that answers that question. I have ADHD and have tried every barrier, fidget therapy, support groups over the years with little success. Have you ever heard of another medication, vitamins that help reduce the behavior? I've read some recent studies, yep, with some success with NAC. Oh, memantine, there we go. Thank you for this question, because that was the newer medication that I couldn't remember the name of. And I'm interested if those may help. So yes, again, right now, NAC is the most popular one. Memantine is newer and just getting started on research now, but both are promising. So again, it's that combination. I'm sorry that you've tried so many things and nothing seems to be working. It is so frustrating, but don't give up. Keep trying. They might be working more than you think and feel. Just something to keep in mind. Nothing is going to work maybe 100%, but you got to kind of find an experiment with that combination of factors. Every time you use a barrier or a fidget, it's helping. Keep that in mind. Okay. So I've mentioned NAC a couple of times, and someone wants to know my opinion on it. Everyone reacts differently to it. I like it. I think it's helpful. I think it's got pretty low risk factors, pretty low side effects. So I say it's worth a try. Some people feel nothing. Some people don't like it. But talk to your doctor about it if it's something that you're interested in. Again, right now, that's the most promising one. That's not the answer. And there is no magic answer. So even if you try NAC, it's not going to just, oh, skin picking is done. It's maybe that is helpful along with the other treatments that I mentioned. I wish there was a magic answer, but there is none. Oh, do you know if there are any foods that can make it worse? I noticed a reduction after going gluten-free for a while, but not sure if it was directly correlated. I'm not sure. I forgot her name. Maybe it will come to me later. There's a woman who does a lot of stuff with BFRBs and nutrition. You might be able to look her up if you just look up actually, I think there's two of them. You might be able to look them up if you just search BFRBs and nutrition. That said, I'm not sure about gluten. I do know that some people have mentioned, I believe there's some research that sugar can affect it. And my guess would be caffeine too. I would say sugar and caffeine can affect urges. Um, but I'm not an expert on that. So I would say, so I don't know about gluten, but I would say sugar and caffeine, and maybe look up those two people. I wish their names would come to me at the moment, but there are at least two people that focus on BFRBs and nutrition that are out there in the field. And actually, now that I'm thinking about it, if this is a topic you want to learn more about, you can also email support@skinpick.com and suggest it, and maybe we can do a webinar and we can do some more research on this for you and present it to you. So maybe this is a good topic for a future webinar. Oh, so someone's answering a question that was asked before about the kinds of bandages. So they said they sell large hydrocolloid band-aids at drugstores, and that might work for the person who asked about bandages. Good to know. Yeah, they sell bandages in all different shapes and sizes. So it's important just to like experiment and see what works. And again, be mindful of any potential skin reactions. Oh, I have enjoyed using a roll of paper tape, and gauze for trickier spots that typically Band-Aids don't accommodate. Yes. Yep. So that's a really good follow-up question to the one before, actually. So yes, if you can't find a Band-Aid or bandages that are in the right size, just different kinds of gauze, and then using like paper tape or medical tape around. Um, that's helpful. Yes, I agree. And the same thing, just make sure, be mindful of any potential skin reactions. Would you consider skin picking to be self-harm? No, skin picking is not self-harm. Self-harm is different. Self-harm is when someone is doing something with the intention of harming themselves or hurting themselves. They self-harm is to reduce a sensation. Um, Picking is to relieve, to soothe. The fact that there's maybe wounds after picking, that's an unintentional outcome. So that person did not pick for the purpose of harming. The harming was kind of by accident. They picked for the purpose of soothing and self-regulating. So they're two different things. For bandages, I don't know which one is good for sensitive skin. You're going to have to do a little research and just try different things and just see what works and what doesn't, because everyone's skin is a little bit different. I wish there was a way to connect you guys. I'm getting more from moms to moms. So check out some of those support groups so you can connect. I don't know if you guys can see the questions and answers actually. So, I mean, if you can see each other's, if you can see it and you can see the other person, I mean, maybe you can reach out there because there is no chat feature in here, unfortunately. Let me see. Yeah, so I find stressful assignments at work or school to be a picking trigger. Absolutely. Especially when I'm alone. Yep. At a computer. How could I cope with this situation without picking? So this is great that you're aware that this is a trigger and this is a situation. When you're aware of what a potential trigger situation is, that means that you're better able to prepare for it. So for example, if you know you have an assignment coming up and you're about to sit down at the computer, think about putting on gloves before going on the computer or putting on Band-Aids before getting on your computer. Make sure you have fidgets out on your desk. They're right there. So they're already ready for you. You want to be prepared and ready for the situation. Maybe you want to have some water with you, right? Which I don't have with at the moment. So you can kind of take a drink of water every time you have an urge. Um, um, maybe you want to set a timer so you can take breaks, right? Stand up from the computer, take a walk, stretch. These are things that you can kind of plan in advance so you have an idea of what you're going to try to do. That said, picking still might happen. That's okay, but at least you were prepared. You tried some strategies. You were ready. The more you practice, the easier it will be for next time. So those are just some ideas, I would say. Okay. So is skin picking comparable to an addiction, such as alcoholism and smoking, etc.? So interesting question. There was recently a webinar on this topic, actually, on BFRBs and addiction. So check it out under, go to skinpick.com and look under past webinars and take a look, because I believe that there was a talk on this. I want to say they're different, but they're also similar at the same time. There are some kind of researchers in the field who are trying to make more connections to skin picking and addiction right now, although they are different. I'm not the best at explaining the differences here. It was explained really well on that webinar, which I really liked. So I'm not sure I could explain it as well as they did on the webinar. But it is different. And one difference is actually skin picking is harder. It's harder to manage than addiction. And I say that because skin is on you. You are attached to it. With addictions, you are not attached to alcohol. You are not attached to smoking. So unfortunately, skin picking is harder. I hope that kind of answered your question, but look up that webinar. Okay. Does anyone else find that they pick not only due to stress anxiety, but also, if not more so, due to the idea that there is something under the skin that needs to be removed? That the extraction of whatever skin substance is there is the main motivation. Yes, I've seen this many times, actually, that there is, sometimes people who skin pick feel like there's something underneath their skin or see that there's something underneath their skin. It really, really, really bothers them or really, really makes them uncomfortable, and therefore it needs to be removed. So with that, I would say very first step is to rule out medical. So again, make sure you go to a dermatologist and make sure that nothing medical is actually going on. And if there is something that is there, something there that's bothering you, that hurts, then that can be treated by a dermatologist. If nothing is there, nothing is actually there, and you've ruled out medical, then you can start looking into some of these BFRB treatments. But that is a common feeling. It's quite uncomfortable. You are not alone. Okay. Oh, okay. Yes. So I have tried to find a therapist slash psychiatrist that has experience with skin picking, and I've had zero luck. I've been in therapy for years, but I've had no luck curbing these urges. How do I find someone who knows how to help? Yes, good question. So if you're looking for an in-person therapist, depending on your location, you can look up trained providers. You can look up trained providers on skinpick.com. There is a provider list. I'm not sure how up to date that is, but there are providers listed there. There is also a provider list on bfrb.org. So you can look up by your area where you are located. If you are still not finding anyone on those lists of trained providers, you can do something or consider something virtual like skinpick.com, which is a virtual program. All the therapists in skinpick.com are trained. They're all really good. They all know what they're doing. They also all really enjoy the work. So it's a really great place to connect with someone. So that would be my recommendation. Okay. Oh, okay, let's see. Of course, shadow work revolves. This is the follow-up. Thank you for answering me. Shadow work revolves around the Jungian concept of the shadow, the deepest part of our psyche, typically prompts usually have to do with healing, finding ourselves, trauma, relationships, etc. They can be very heavy questions, but they are meant for self-exploration, and oftentimes, for me at least, they work quite well. Okay, thank you. I still have to think more about this one. Yes, your explanation is reminding me of it. Yes, I am familiar. I don't know if I can like quickly come up with like questions and prompts regarding this topic. As you're working with a therapist, whether it's private or here on SkinPick through their program, questioning happens back and forth. So the more you engage with someone, the deeper the questions wind up getting. So if things start coming up, like trauma or things with the self and relationships, it will be addressed. So I don't have any specific questions off the top of my head. But I think those deeper questions come while you're working with someone. Oh, as a teen girl with bipolar 2 disorder, would you say that an uptake in skin picking behavior would coincide more with a manic or depressive episode? Interesting question. Um, I would say it would be either, actually. I don't think it would be one over the other. Sometimes in a manic episode, you might be overstimulated. That's an example of overstimulation. So that might trigger some urges where you're getting overwhelmed, very excited, and you're doing lots of things. Or in contrast to that, you might be kind of so active that you have no interest in picking. In a depressive episode, right, you might be feeling really depressed, kind of looking very inward, and might be picking more. Or in contrast, if you're too depressed, maybe you're too depressed and you don't even have the energy to pick. So it could be both. I wouldn't say one necessarily coincides more with manic or depressive. I would say it could be both, either or, but I would actually maybe lean towards more towards the depressive episode. Mainly because when you're manic, you might also want to be engaged in more activities. So if you're more active and busier, typically picking is a little bit less when you're so busy. If you're depressed and you're staying home, or you're by yourself, you're more likely to kind of get more into yourself. So it could be either, but I would say maybe a depressive episode has a little bit more of a risk, which is good to know. So you can kind of prepare for it the best you can. Uh, let's see. Oh, someone is saying they love the hydrocolloidal bandages. It's a great barrier and blended well with your skin. Great. Thank you. Thank you for contributing that. I love it when I love it when you guys add things in the question and answer that help with questions. It makes it a little bit more interactive. I love that. Okay. Oh, I'm looking at the time. We have a couple more questions. Um, oh, this is recently has come up. This question, does being on ADHD medication, stimulants like Adderall, tend to help, hurt, or it depends? I've seen people comment on Reddit that they see a reduction potential from impulsivity control on meds, and others thinks it increases. Wonder if there's any link or if it is more based on a person and mental state. I would say it depends. Recently, I'm getting a lot of folks that are saying that their ADHD medication is increasing their picking. Um, that said, in the past, I've gotten more people that have said that it has helped, and it has helped to regulate them. So I think it just really depends on the individual and how it's interacting with them. Um, Again, I would say it's always worth a try. If you're noticing that it's increasing those urges and picking, then it's not the right medicine for you, and you change or decrease and try something else. Uh, so someone here is mentioning, I've had an issue with Band-Aids, and the waterproof Band-Aids work best for me because they seal all the way around. Oh, and they're saying they cannot see all the other questions. Okay, thank you. Yeah, I wasn't sure if you can see it or not. Thank you for answering me. Waterproof Band-Aids, yes, I like that they seal. What I don't like is it doesn't allow any air circulation. So I don't necessarily like Band-Aids that are totally closed off from air. If you do have a Band-Aid that seals very tightly and very well, make sure you're changing them frequently, because you just don't want it to be like wet underneath the Band-Aid for a long period of time. Um, Yes, there are there are support groups all over and popping up everywhere now. Skinpick.com have support groups available. If those, days and times don't work for you, as I said before, TLC or BFRB.org, they've gotten a bunch of support groups up and running um, through their organization. In addition, you can search on their website for support groups in your area. So there are support group options there. Other support groups, there are support groups through pickingme.org. They have a support group, virtual support group. Um, um, the BFRB change makers, they're starting to get and habit aware. They have some support groups that are starting to go up and running. So there are lots of support group options. I do recommend trying a support group. Every support group is going to be a little bit different because it depends on who's there and the dynamics and interactions of people. But it's really nice to join a support group so you feel less isolated, less alone, and just really helps you to connect to people. And it's a nice way to make friends with people that understand. Okay, I'm seeing some thank yous. Um, hmm, yeah, I'm just seeing some more medication questions here. Let me see. I think I answered this question already. Can you talk about some useful coping skills? So we talked about, for example, skills within that SCAMP model. We talked about medication. Um, oops, yes. So someone here is writing, they've had this issue for a very long time. And I hope this will not happen to any more children. I hope so too. Um, It's frustrating. It's a really frustrating disorder. Um, I must say. But the good news is that now it is getting more well known. And the more well known it gets, the more likely it's going to be researched. And the more research that's out there, the more likely it is that there'll be medication options or other treatment options. More and more discoveries will be made, the more it's out there, the more we know about it. So that is the good news as we kind of go on. Um, and for the people who are older and who are around the younger generation or children who have it, the good news is that you understand it, and you can help and you can support and you can be there for them. Um, and that helps to reduce that level of shame and guilt and to feel less alone. Okay. So, all right. Did I miss anything? Oops. Oh, wait. I think I got most of the questions in the question and answer. I can't believe I got through them all. We're a little over, but I will, if there's anything else anyone wants to add, I'll wait a little bit, see if there's anything you want to add in the question and answer section. But if not, we went over a lot today. So I hope it was really helpful. Thank you so much for joining. If there's something that you decide later on that you want more clarity on, or you have another question, feel free to email the support at skinpick.com. Hold on a second. I think I saw a hand raised. Oh, maybe not. Okay, it disappeared. I think it disappeared. So, okay. Yeah. So further questions, please email support at skinpick.com, and we will, or they'll forward it to me, and then I will answer any additional questions that might come up. And I hope this was really helpful for everyone. And thank you so much for joining me. We will be having this sporadically. So if something does come up again later on and you don't email me, don't email us. We'll have another one. There'll be another opportunity. Okay. So thank you so much, and hope everyone has a good evening or morning, depending on your time zone, or afternoon. And thank you again for joining. Take care, everyone.